Hello, this is Dr. Ron Valdesari, and I'm reporting from the 19th International AIDS meeting here in Washington, D.C., and I'm joined by my friend and good colleague, Don Averitt Bridge, who is the founder and chair of the Well Project. And Don, first of all, thank you for being with us here today. We really appreciate it. You've been a leading force behind the HIV Awareness Month. What's that all about?
National HIV Awareness Month really is something that came about very organically from a group of community leaders coming together and saying, how do we get the private sector, civil society at large, even just the American people to start talking about HIV? We have awareness days, as you point out, National HIV Testing Day, we have World AIDS Day, we have a number of other population-specific awareness days over the course of the year. But ultimately, we haven't had an awareness month that really gave some weight and some girth to the issue, an opportunity for people to get involved, and especially those who haven't been involved in the conversations so far. So we came together and said this July, when we got the International AIDS Conference here for the first time in more than 20 years, let's come together for National HIV Awareness Month and engage the private sector, engage all the organizations who do such good work already, and engage the American people.
Why do you think, and there's just been another report released that continues to show that the American public is less and less concerned about HIV/AIDS in our country? They tend to still think about it as something that's out there. But why do you think that's so, and what can we do to change that impression?
Well, I hope National HIV Awareness Month is a big step in the right direction. I think that, probably like you, since we've worked in this field for so many years, when I sit down on planes or trains or in public places next to people and they ask me what I do and I tell them that I work in HIV, their reaction is always the same. They always say, it's terrible what's happening in Africa. And they're absolutely right. There have been some really horrible, there's no disputing the impact of the global pandemic, but they don't know what's happening here in their own backyard. And when I tell them that nearly 1.2 million Americans are living with HIV and 50,000 are infected with HIV every year, they look stunned. Like, really, why don't we hear about this? Why don't we know about this? And, some of that is that the media has found it hard to talk about HIV domestically. The global stories are really compelling, and rightly so. But I think that the reality is we haven't done, unfortunately, a good enough job in integrating HIV into the discussions that happen in the schools, in the doctor's offices, in community education forums, and then just in general around the family dinner table in America. As we've gone to the companies and asked them to get involved, many companies from other sectors have said, we don't really deal with HIV or health-related issues. And I said, no, but you have American citizens who work for you, and you have American citizens who are your consumers. And what we need you to do is begin to share with them the impact of what we have. We are dealing with an almost entirely preventable disease.
Exactly. I know a lot of your career, you've done some really innovative work bringing together partnerships. Can you maybe generically talk about some of the partnerships that have been recently developed as a result of the National HIV/AIDS Awareness Month?
So one of our great new partnerships has been with Major League Baseball, with a couple of the organizations, including the Washington Nationals and also the Chicago Cubs, who did a game at their home stadium on the 19th of July, and then this past Sunday on the 22nd of July, the Washington Nationals hosted the National HIV Awareness Month Day game at their home stadium during a sold-out game, and it was a fabulous day. 40,000 people in the stands heard about HIV and the impact. We previewed the Greater Than AIDS public service announcement that they recently released, and it was a really nice opportunity to put HIV in front of a segment of the American population who might not always talk about it. Through sponsorships and other mechanisms, we were able to get tickets that we were able to give to testing locations around DC, to give out to people who decided to come and get tested.
Yeah, very interesting.
And with some of the remaining tickets on the way to the game, we gave them out in the subways. And I have to tell you, it was the most fascinating experience because people, first of all, everyone is very suspicious of somebody giving away something.
A free ticket.
Yeah, a free ticket. And so I had to say, no, it's National HIV Awareness Month, and we wanted to get people involved, and people got tested and got free tickets, but we have some left over, and we don't want them to go to waste. And they said, well, what do I have to do? And I said, well, would you wear this sticker? And you're going to give me a baseball ticket? Yes, absolutely. And so we have all these wonderful images of people, hugging us and holding on to their tickets and their stickers.
Right.
And afterwards, my whole team reflected on the fact that we probably made more headway in the subway giving away free tickets to people who were completely unsuspecting than we would have taking out a full-page ad in the New York Times.
Good for you. Good for you.
So those kinds of opportunities to get in front of 40,000 fans in a Major League Baseball game and say, this is the deal with HIV, this is our problem, and you all have a role to play, I think has been very, very significant. We're excited about what it could mean.
Thank you so much for sharing those really exciting examples with us. And I think what we want to say to all of you, listen to what Dawn had to say, and if you're not involved in addressing and confronting HIV/AIDS in America, there are many opportunities for you to be involved. You don't have to be a healthcare provider. You don't have to be a public health expert. You don't have to be a person living with HIV/AIDS. You just have to be an American who's concerned. Help us keep awareness alive. This is Ron Valdesari reporting from the International AIDS meeting in Washington, D.C., and thank you so much, Dawn.
Thanks for having me.